Hi, everyone. My name is Marnie Michalak, and I'm a nurse practitioner working with Wellness MD. I have a special focus in lesion consultation and removal, biopsies, skin rejuvenation, hair removal, and IV therapies. Today, I'd like to discuss menopause and skin changes and treatments that are available. A patient came into our clinic recently. So it was a woman in her early 50s, and she shared with me some concerns that she had with her skin. She said, "My skin is really dry and sensitive. I'm breaking out like a teenager again, and now I have these strange little growths that weren't there before." She paused and she said something that really stuck with me. "I feel like my skin aged 10 years in one." And honestly, she thought she was the only one. But the truth is, millions of women experience this exact moment during perimenopause and menopause. What she was experiencing wasn't unusual. During menopause, declining estrogen changes the biology of our skin. In fact, women lose about 30% of their skin's collagen in the first 5 years after menopause. That affects hydration, elasticity, oil production, pigmentation, and even the blood vessels in our skin. And suddenly we're dealing with dryness, breakouts, redness, dark patches, and new skin growths. But here's the part that I love sharing with patients. These changes are not a personal failure, they're biological. And the even better news is that they're very treatable. Today, I want to walk you through the most common skin changes during menopause and the tools that we have to treat them. Estrogen plays a huge role in skin health. As mentioned, in the first 5 years after menopause, women can lose up to 30% of their skin's collagen. That loss contributes to thinning skin, reduced elasticity, deeper lines, dryness, and irritation. These changes are biological. Again, it's not something that you caused. These are the skin concerns I most commonly see in perimenopausal and menopausal women. The key message I want to leave you with today is simple. Every single one of these has treatment options. The most common concern women bring up is dry skin. Estrogen supports your skin's ability to produce 4 essential components, so ceramides, hyaluronic acid, sebum, and collagen. When estrogen declines, your skin loses its natural moisture barrier. Water evaporates more easily, leading to dry, itchy, and sometimes irritated skin. Management includes avoiding soaps that lather, foam, or bubble, as these will strip away oils from your skin. Use a gentle, non-foaming cleanser instead of soap, and try to get in the habit of moisturizing your skin twice a day. When you're selecting a moisturizer, look for lotions that contain ceramides and hyaluronic acid to assist with skin hydration. Daily SPF 30 plus for sun protection is a must for everyone at all ages, and hormone replacement therapy monitored by a healthcare professional may also help with dryness. Many women are surprised when acne returns during menopause. Women who had acne as teenagers are particularly prone to midlife breakouts. Estrogen plays an important role in your skin's health, promoting hydration, reducing oil production, and helping to stimulate collagen and elastin production. During perimenopause, your hormone levels fluctuate and become unbalanced. This causes your sebaceous glands to produce more oil, which can clog your pores and contribute to acne development. Progesterone is an anti-inflammatory hormone, and fluctuating or reduced levels during perimenopause and menopause can trigger inflammation, excess oil production, and changes in skin cell turnover, all of which also contribute to the formation of acne. There are 2 categories of acne: non-inflammatory comedones, so those are blackheads and whiteheads, and inflammatory papules, pustules, nodules, and cysts. Treatment choices depend on the acne severity, and goal with treatment is to minimize further breakouts and scarring. Treatment usually starts with benzoyl peroxide and salicylic acid. So benzoyl peroxide works to minimize the bacteria that play a role in acne breakouts, while salicylic acid helps to prevent pores from clogging with dead cells by promoting the skin's natural exfoliation process and breaking down excess oil. Connecting with a healthcare provider for a tailored skin plan is the best option. You may require topical antibiotics, oral medications, or isotretinoin for severe or resistant acne, and your provider can help to monitor process, which can take months and requires a lot of patience. Other procedures such as IPL, which is intense pulse light, or light therapies, can decrease acne bacterial load and lower inflammation with minimal downtime required post-treatment. Chemical peels and microneedling can also address moderate to severe scarring by stimulating collagen production and resurfacing the skin, but there's usually a longer recovery time. Flushing is a well-recognized symptom of menopause and is described as a generalized spreading or a feeling of heat throughout the body. It can also occur from rosacea, a condition in which the blood vessels in your skin become very reactive. But flushing and rosacea affects the central part of your face, so usually the forehead, nose, cheeks, and chin. Rosacea is most common in women around the ages of 45 to 60, and reduced hormone levels can contribute to rosacea either developing or worsening. Many women find that their rosacea worsens during perimenopause and menopause. Rosacea can cause the following symptoms. So blushing, redness, and flushing, which is not usually present on skin of color, bumps and pustules that look similar to acne, stinging and sensitive skin. And in severe cases, it can cause skin thickening, which is usually around the nose called rhinophyma. Rosacea seems to be more common in women, especially in menopause, and can be triggered by alcohol, caffeine, spicy foods, and sun exposure. Management involves developing a personalized skincare regimen, so usually a gentle non-foaming cleanser, a light moisturizer, azelaic acid cream or gel, and sometimes topical antibiotics, use of sunscreen and sun protective measures, avoiding triggers, and IPL, again, intense pulse light or laser treatments that can shrink the tiny blood vessels in the skin. Hormone replacement therapy can also help to improve rosacea in some women. Melasma appears as distinct patches of skin pigmentation that are darker than the surrounding skin, generally symmetric, light to dark brown or gray-brown with irregular borders, and they typically appear on sun-exposed areas of the face, so usually the cheeks, forehead, nose, upper lip, and occasionally on the neck or forearms. There's a clear association with melasma and estrogen, which is demonstrated by its association with pregnancy and oral contraceptive pills. Melasma may also develop following treatment with hormone replacement therapy, but beyond hormones, sun exposure, heat, and slower skin cell turnover can contribute to its development. Treatment usually involves topical creams, so hydroquinone, it's a type of bleaching cream, retinoids, azelaic acid, and tinted mineral sunscreen will help with its treatment. IPL and laser therapies, chemical peels to break up the pigment, are used with caution because heat can also potentially provoke melasma. Signs of sun damage may become more prominent around perimenopause and menopause, especially for anyone who has spent a considerable amount of time in the sun over their lifetime. Sun damage can present as a regular skin tone, lackluster skin and sunspots, also known as age spots. These are flat, brown marks that show up on your face, décolleté, and arms. Thread veins, lines, or wrinkles may also develop in relation to prior cumulative sun exposure, and the drop in estrogen during menopause, which compounds the loss of skin collagen and adds to the signs of aging. The most important changes you can make are to cut out habits that cause skin collagen levels to decline, such as excessive sun exposure and smoking. Serums containing anti-aging ingredients that preserve skin collagen levels, so for example, topical retinoids and vitamin C, can be helpful. And developing a targeted skincare routine and consistent use of sunscreen can help to modify and prevent further signs of aging. Botox and fillers may be an option for static facial lines, but this will not be the focus of the lecture today. A simple but targeted skincare routine can make a major difference. Vitamin C protects against environmental damage and brightens the skin. Vitamin C serums are applied in the morning, and they help to provide the skin with skin brightening benefits and antioxidant protection against environmental aggressors. When used together, retinol and vitamin C provide a comprehensive approach to skincare that addresses multiple complexion concerns, including stimulation of your skin's natural collagen synthesis. Simply put, retinol stimulates collagen and improves texture. Retinol serums are applied at night because they increase your skin's sensitivity to sun exposure, and it may cause some dryness or irritation. It's generally advised to apply it a few times a week and increase as tolerated. Hyaluronic acid is a natural component of the skin that helps to maintain your skin's moisture levels. When applied, hyaluronic acid forms a layer of hydration on the top of the skin, providing softness and smoothness. It is suitable for all skin types and is non-comedogenic. Ceramides. So those are waxy lipid molecules that form a protective waterproof barrier that keeps out pollutants, irritants, and bacteria. They prevent moisture loss, ensuring the skin remains hydrated and soft. And niacinamide. So when topically applied, niacinamide can help to strengthen the skin's moisture barrier, which can help reduce moisture loss and dehydration, and even help reduce the visible effects of environmental damage. So skin will appear healthier and more radiant. Glycolic acid and lactic acid are skin exfoliants that help to remove dead skin cells and promote healthy skin turnover. You may not be able to prevent menopause from changing your skin, but you can take steps at home to help restore it. Don't skip SPF. Because sun exposure is one of the main factors in skin aging, it's essential to wear SPF daily, even when it's cloudy and during the winter time. When purchasing a sunscreen, you should be aware that there are two types which are differentiated by their active sun protection ingredients. So there are classical versus mineral types. Classic sunscreens use chemically active ingredients to absorb and dissipate UVA and B rays, while mineral sunscreens use ingredients such as zinc oxide and titanium dioxide to act as a barrier on the skin, scattering and deflecting the sun's rays. We now also have to be aware of blue light rays, strong, high-energy visible light that emits from the screens of electronics. It's part of what is referred to as digital pollution, and just like environmental pollution, it's taking a toll on the health of our skin. It can cause premature aging and pigmentation. SPF, sun protective factor, is a measure of protection from harmful UVB rays. When selecting a sunscreen, use a broad-spectrum SPF 30 or higher to protect not only against sunburn, but to reduce the risk of skin cancer and premature aging and wrinkling that's caused by the sun. Reapplication is crucial and must be done every 2 hours or immediately after swimming or heavy sweating. I personally prefer to apply a lotion 30 minutes before sun subjection, using a full mirror to ensure full coverage, and then I reapply during the day with a spray. These growths are extremely common during menopause. They're not dangerous, but they can be irritating or cosmetically bothersome. The good news is that removal is usually quick and straightforward. Cherry angiomas, skin tags, and seborrheic keratoses are all benign growths that frequently appear or increase during menopause due to the plummeting estrogen levels and hormonal fluctuations. Cherry angiomas are caused by an overgrowth of blood vessels and increase during pregnancy and menopause. Skin tags appear in areas with increased friction, so the neck, underarms, and groin. They can rub and be irritating. Seborrheic keratoses can be found on the face, neck, chest, back, and scalp, and can be itchy. Although none of these are harmful, they can be removed easily for cosmetic purposes. IPL, so intense pulse light, is a gentle procedure that can be used to reduce fine lines and wrinkles by stimulating collagen production. It can create a more even skin tone by decreasing hyperpigmentation and age spots from sun damage, and reduce visible blood vessels called telangiectasia and redness for conditions such as acne or rosacea. IPL can be used on the face, arms, legs, décolletage, and or on the upper back. We usually recommend 3 to 5 treatments to see the best results, and there's minimal downtime between treatments. It could also be used for cherry angiomas. And for skin lesion removal, there are a few different treatments that can be used depending on the type of lesion and its location. So there's cautery and curettage, surgical removal, cryotherapy, which is liquid nitrogen. In my practice, I often combine techniques to achieve the best possible cosmetic outcome. So for instance, with larger skin tags, seborrheic keratoses, and benign moles, I usually start with a small injection of lidocaine with epinephrine to numb the area. This sting is brief, and I'd say most clients rate it at about 3 out of 10 on the pain scale. Once numb, you won't really feel anything during the removal. And then after the lesion is removed, electrocautery helps to control bleeding and refine the edges for a smooth and natural result. If there's any uncertainty about a lesion's diagnosis, a sample is sent for histopathology. Results typically arrive within 1 to 2 weeks. Cryotherapy is a non-surgical option ideal for warts, superficial brown spots, and some seborrheic keratoses. It freezes the targeted skin, causing it to blister and scab as new healthy skin forms underneath over a few weeks. This is a great choice for anyone who prefers to avoid needles. Aftercare, so healing is very simple. You need to apply Vaseline or polysporin twice a day. Tylenol can be used for mild discomfort, although most people don't need it. And just make sure to let the area heal naturally, so picking at it can slow the process and may affect cosmetic results. I always remind my patients that investing in your skin isn't about vanity. It's about feeling comfortable and confident in your own body. Menopause is a time of transition, but it's also a time where we can take intentional steps to support our health and well-being. At Wellness MD, we work with women to create personalized treatment plans. That might include targeted skincare procedures like IPL, removal of benign growths, or hormone therapy support. The goal is simple, helping you to feel your best. Thank you so much for being here today. I hope that this conversation has helped to normalize some of the skin changes that will happen during menopause and showed you that there are many ways to treat and manage them. Thank you so much.